Namaste and welcome to the next lecture of Clinical Ayurved. Myself, Dr. Mayuresh Agte. We were discussing Ratta Pitta, and in that discussion, we have reached to a very different point, that it is the internal bleeding which can be termed as Ratta Pitta, and the blood now after bleed has been clotted. Now we are going to treat this patient with having reports with you, and I just remind you that after bleeding the blood has clotted, and now that clotted blood itself is in the way of the blood flow, making marga avrodh. Now how you will define this condition and how we can treat this samprapti uh, in the patients, because this is a very routine reports, as again said, I have said earlier, that you will find many cases with this type of the MRI or CT scan reports. Now it is internal bleed, okay, so you can, at that time when it was bleeding it was Ratta Pitta, and now it is the Ratta Skandana and making Marga avrodh. As I said in last lecture, that to what will the logical treatment or principal treatment, you have to make the path clear after breaking this marga avrodh in the Raktavaha Sira or Raktavaha Srotas. In that regards, I told you that in the Guna, Gurvadi Guna, there is Bhedane Tikshnaha. So, by logic, you should go for the Bhedana Guna to reduce this marga avrodh in the Raktava Sthira. Okay. Now, in Ratta Pitta Hetu, what we have seen, the main Hetu are Ushna and Tishna Guna. Now, in this case, if there is, we are nominating this disease as Ratta Pitta, internal bleed as Ratta Pitta, when it was actually bleeding, that may be the reason of the Ushna Hetu, or maybe the other reason, like mainly which is found is high blood pressure, uncontrolled blood pressure. So if the Hetu are Ushna and Tishna, if you take the case and see the Hetu are Ushna and Tishna, is it possible to use Tishna Guna itself in this condition? It may be risky, because again, if the Hetu is Tishna Guna or Tishna Ushna Guna, for Bhedane Tishna by rule, if you use Tishna Gunatmak Dravya, then it may prove risky to the patient, because already the cause is the same Guna. So, what is the choice? You have to think of the Bhedan Karma, you have to think of the Bhedana Karma without Ushna Guna. Is it possible? Is it possible? Bhedan Karma without Ushna Guna, is it possible? I am repeating again. And yes, it is possible. How? In such case, for Bhedan Karma, you can use dravya like Kumari, Katuka, which are of Tikta, Katu, Shita Gunatma, but both of them have Prabhav Bhedan. Understand? To achieve Bhedan Karma in this condition, you can use Katuka, Kumari like dravya, which are not of Ushna Tishna Guna, but their Prabhav is Bhedan. First thing. Second important thing, always remember, only Bhedan Karma is not sufficient as a principle of treatment. You have to choose the Bhedan Dravya which have gone Gamitva under Rattavastriya. I have told you in the previous lectures that you have to choose the Dravya with the desired karma, having capacity to do the desired karma, but that dravya should also have gamitva on that particular sotas. I think I have given example of Vasa, Lodra, Ashok, Kutaja. All are Raktastamban, but Vasa has Gamitwan, Urdhva, Raktapitta, Lodra on Adogo or mainly Garbhashay, Ashok on Garbhashay, Kutaja on Pakvashay. Same way, here Bhedan Karma principally we have decided, but Bhedan Dravya which will act on the Raktavas Dhatu or Raktavas Sotas are to be chosen. Second thing, and third thing, if Ushna Ishna Hetu are there, then you can have to choose Dravya like Kumari Kotuka, which will create Vedan Karma by their Prabhav, and they don't have any Ushna Tishna Gun in their properties. So here this is the Samprapti of Margavarajanya type, and in the Raktava Sira or Raktava Srotas, so Vedan Karma by Prabhav of Dravya like Katva Kumari can be used. If the condition is high blood pressure or uncontrolled blood pressure, and because of that Samprapti happened in the patient, then again Hetu Parivarjan first. If the Hetu is high blood pressure, you can nominate whatever it is, Pitta, Vritta, Vat or something, what you like, it doesn't matter. But first will be to control the blood pressure. Second treatment again will be Bhedan for the Aurojana Samprapti. Now in this case, there are no Ushtarishna Hetu as such, because the reason is Hetu is because of Pitta Vritta Vat condition or high blood uncontrolled blood pressure. Here if there is no any relation of Ushna and Tishna Hetu directly, then you can use normal Bhedan Dravya having Tishna Gun like Gugulu etc. Amrita Gugulu like Dravya, Chitak like Dravya, which will be having Bhedan condition, and they will reduce the Sotoro if and if only you will find that there is no direct relation of Tishna and Ushna Hetu in this pathology or Samprapti. So, what will be the final conclusion? After internal bleeding or Raktapitta, after some period when the condition is like infarct or ischemia because of the clotted blood, line of treatment Bhedan. If Hetu or Ushna Tishna, then go for the Bhedan Dravya having Prabhav and like Kumari Katuka, and don't have Tishna Ushna Gun in their properties, thereof Tikta Katu Shita Gunatma. This is the first line of treatment. Second type of patient, the reason is other than Tishna Ushna Hetu like uncontrolled blood pressure, then in that case you can use Tishna Ushna Gunatma Dravya like Guru having Gamito on Raktava Sira to reduce this Margavarajanya Samprapti. Hope you understand this condition, this logic. Now when I am using Kumari or Katuka, in which form I will use? I will use them in the form of Kumari Asav, because Asav is because of Asav Kalpana, it has Sukshmatva inherited in the Kumari Asav Kalpana, and when the arteries are very small, which are thrombosed or there is ischemic conditions, they can reach to the smaller arteries also. So Asava Arisha Kalpana will be the ideal choice. Otherwise you can use Dravya like Katuka in the form of Arogyavardhini also. It will definitely help the patient. So this is the logical interpretation of the Samprapti after internal bleeding which is seen in the patient. I will be happy to have your opinions on this subject. We'll meet in the next with lecture with some different topic. Thank you very much.